Good afternoon. I present my case on 46 years old male, occupation writer from E-Road. He referred orthopedic department and weight 60 kilogram, height 160 centimeter, and BMI 23.4. And chief complaint, patient's complaint, pain over the left shoulder for past 10 days and difficulty in lift weight due to pain about 3 kg and difficult functional activities, that is grooming, putting shirts, t-shirts and bathing. And present medical history, a 46 years old male came with a complaint of pain over the anterior aspect of the left shoulder. So before 10 days he had pain while doing activity, but he managed by take resting and applied ointment, and but the pain did not subside and got worsened during the lifting weight and lying on left side and difficult functional activities. So he came to hospital and refer a orthopedic department and consulting orthopedician, and he diagnosed us the left periarthritis shoulder, and he advised for this pain medications and physiotherapy management. So past medical history, hypertension for 4 years and ongoing medication, past medical history nil, and personal history, sleeping pattern normal, mixed diet and alcoholic for past 20 years, weekly once, and non-smoker, non-normal bowel and bladder habits, and occupational history, hours of working about 6 to 7 hours, and socio-economic status moderate, and pain history, pain side anti aspect of the shoulder and side of the pain left side, and pain onset is gradual and duration for past 10 days, and type of pain, thrombing pain, and deep depth of pain, deep, and nature of pain, inflammatory, and aggravating factor, so pain during aggravating movements, that's grooming, putting t-shirt and shirts, and relieving factor, rest and applying ointment on medication. And intensity of pain, I take a NPR scale, that is about 6 point. Vitals, temperature, pulse rate, respiratory rate, BP and SpO2 are normal. And objective examination, so body build mesomorphic and posture high sitting, and attitude of limb are normal in shoulder, elbow, wrist, finger, and hip and knee, ankle also. So shoulder also normal, that is both sides have a slight flexion and flexion only. So breathing pattern, abdominal thoracic breathing, and external appliance nil, and muscle wasting, no obvious muscle wasting on both upper limb, and swelling absent, deformity also not present in spine, bilateral upper and lower limb, and gait is also normal. And on palpation have warmth present over the anti-aspect of the left shoulder, and tenderness also present on the anti-aspect of the shoulder, and edema not present, and muscle tone is firm, and trigger point not present in around shoulder, necks, and distal pulse are felt on both upper limb. So on examination we have a special test. So I test about periarthritis shoulder. So patient position, the test can be performed with the patient in either sitting or standing, and technique, and ask the patient to touch the medial board of the scapula by the internal rotation of the shoulder, and positive sign when it does not get to touch the opposite side, so result is positive. So this test is positive for this patient. So I diagnosed as he had a periarthritis shoulder. So diagnosis, medical diagnosis also left side periarthritis shoulder. So medical management, a tablet Amlong 10 mg for BP, and tablet naproxen, and tablet Dolo 5 mg, 500 mg for pain medication. Problem list, pain over the anterior aspect of the left shoulder, and reduced range of motion for left shoulder, and reduced muscle tone left shoulder, and difficulty in functional activities, and difficulty in doing this occupation for prolonged also. And short term goals, to reduce pain on the anterior aspect of the left shoulder, and to improve range of motion on left shoulder, and to improve muscle power on left shoulder. Long-term goals to improve functional activities and also to perform this occupation without pain. And physiotherapy management, give ultrasound therapy, so application of method, the direct contact method, and treatment parameters, frequency 3 MHz and intensity 1.5 watts per centimeter square, and mode continuous, and duration about the treatment duration is 5 minutes only. And exercise active movements increase for left shoulder for 10 repetition, and the isometric exercise increase for left shoulder, and pendular exercise increase for left shoulder for 5 repetition, and band exercise increase for 5 repetition, and finger ladder exercise increase for 3 repetition, that is in a flexion, shoulder flexion and shoulder abduction in the ladder exercise. And home advices for patient: hot water fermentation for 10 minutes, and do exercise regularly, and avoid sleeping on left side of the shoulder, and avoid lift heavy weights by using left arm.